Okay, folks, it's a Friday afternoon, September 22nd. You better put on your seatbelts and buckle up. My stars, you can't make this stuff up. I'm almost glad the month of September is almost over because let me tell you what these articles are saying, and they've all come across my desk this month. First one, Conservative News Daily, article September 15th, 2023 by Aldra Fredley. Google will pay California $93 million to resolve location tracking lawsuit. Google is now going to pay California $93 million because Google was using consumers' location data without their consent. California Department of Justice found that Google was deceiving people. Their actions were contradictory to what they were telling users. So, the same state, California, that was very willing to play hardball with its citizens regarding tracking, testing, and tracing, now is going to get $93 million from Google. Fascinating. How about the policies that were used to control Americans? Let's take a state like, well, as long as we're hot, let's keep on the same topic. Let's talk about California. Notable and quotable Governor Newsom. Here's an article in Opinion, and it was written on September 10th, 2023, reporting for Politico, Christopher Catalago. Governor Newsom being interviewed. He said, I'm amazed. This is what he said. Governor Newsom said this. I'll take it out of context. Quote, I think we would have done everything differently, end quote. Why did those words come out of his mouth? Because of this. Governor Newsom said criticism of California's tough COVID-19 restrictions were valid, and he would have taken an entirely different approach, given what he now knows about the pandemic. So in a taped interview on NBC's Meet the Press, Governor Newsom says, I think we would have done everything differently. Newsom bemoaned how every decision by him and the White House were all viewed through a partisan prism. Governor Newsom, I've never met you, but perhaps when you're telling everybody in California that they've got to lock down, follow the rules, and wear masks, but meantime, you're at some swanky party in the Napa Valley Hills and drinking wine with a dozen buddies, not social distancing, not wearing masks, and not locking down, that might be why people are viewing some of your policies through a partisan prism. But we're glad to recognize that you now say you would have done everything differently. Okay, let's talk about kids as guinea pigs. The World Council for Health, article by Peter McCullough, September 12, 2023, the World Council for Health said, quote, the number of vaccines given to babies and children has increased dramatically without the necessary due diligence by regulatory authorities, end quote. Dr. McCullough's article went on to say, the COVID-19 crisis has demonstrated that regulatory bodies, once public protectors, have been deeply corrupted by vaccine industry interests. All week, I have had patients asking me, what should I do about the vaccines? When should I get my flu shot? What should I do about the COVID booster? What should I do about the RSV? By the way, what about shingles? People are having questions. And what we're seeing is our protectors are not protecting us. Regulatory bodies are no longer the public's protectors. Many people during the COVID pandemic quoted a physician named Dr. Paul Offit, O-F-F-I-T, a pediatrician at Children's Hospital of Philadelphia. Here's an article by Dr. Vinay Prasad, September 10, 2023, in his Substack. He said, regarding the COVID-19 vaccine, this fall, one more unproven dose marches forward. A new shot is scheduled to debut this month. In the United States, the CDC and the FDA will push eligibility down to 6 months of age. Meanwhile, in the United Kingdom and Australia, they are advising it only for those 65 years of age and older. The difference in these recommendations, according to Dr. Prasad, is staggering. These facts paint a concerning picture that the U.S. policy is unjustified. Here's where Dr. Paul Offit, one of the makers of the rotavirus vaccine 20 years ago, this is what he says in Science. He says that he, age 72, will not get the fall booster. This is what he says. He sits on the FDA's own vaccine advisory group, and he has strongly opposed the broad recommendation for previous boosters and says it makes even less sense now. Quote, the goal of the vaccine is to prevent severe illness. You can't ask people to get a vaccine if you're trying to prevent serious illness and there's no clear evidence that you are at risk for serious illness. Dr. Offit, who is 72, already had COVID-19 once and is in good health, did not receive the bivalent booster himself and doesn't plan to get the new one. Quote, I think I have hybrid immunity, and clearly hybrid immunity is best. That would be immunity that you get from both the vaccine and having had COVID. He says it comes down to the data. If CDC is going to make that broad recommendation, show me why that is. Take healthy 12 to 17-year-olds who have already gotten 3 doses of vaccine or 2 doses in a natural infection. Are they getting hospitalized? This is Dr. Paul Offit, supposedly one of the loudest, strongest, most powerful pro-vax voices in America. So I got an email today from the Department of Health in Minnesota. Here's what it says about COVID-19 vaccines for people 12 and over. It says, vaccine information statements. They're abbreviated VIS in capital letters. They're called vaccine information statements. They're supposed to be given to patients when they receive a vaccine. So if we give a diphtheria tetanus vaccine, we give them a VIS or a vaccine information statement so that they know what they received. It's a part of the informed consent process. Vaccine informed statements not available for 12 years and older. So the Department of Health sends me an email. I'm going to imagine thousands of physicians got this email today, and it says this. The VISs are not yet available for the 23-24 COVID-19 vaccine products for people 12 years and older. That's the one that came out this week that people are now getting. They're not available. A date for when this will be available has not been provided. But the Center for Disease Control and Prevention state it is a priority. Here's where it gets interesting. Providing vaccines should not be delayed even when the vaccine information statement has not yet been developed for a newly approved vaccine. Can't make this up. I'm going to say that again. Providing a vaccine should not be delayed even when the vaccine information statement that's supposed to go to the patient and be a part of the informed consent process has not been developed for that newly approved vaccine. But they go on and say, information about the benefits and risks of the vaccine needs to be relayed to those receiving the vaccine before vaccine administration. So the first sentence says, you should not delay vaccination even if the VIS hasn't been approved. And the next sentence says, but information about the benefits and the risks of the vaccine needs to be given to the patient or to their legal representative before administering the vaccine. How can that be? They give us options. They say, go to Moderna's website and they'll tell you about it. Or it says, Pfizer, they don't have an information sheet for people 12 years and older either. But the FDA has a fact sheet for recipients and caregivers about previous vaccines. Or you could go to the following resource, a CDC overview of COVID-19 vaccines, or a CDC stay up to date, or a CVC about COVID-19 vaccines. This is astonishing. So we're told by the Department of Health, oh, by the way, we don't have vaccine information statements, even though that's a critical part of informed consent. We don't have them available. So we're going to go ahead and tell you, don't let that delay. Go ahead and give the vaccine. But then they say, but don't be given the vaccine unless you've provided the necessary information about the benefits and risks. Oh, yeah, but that's not available yet. So go to some alternative sources. Go to Moderna. Go to Pfizer. Go to the people that are paid for that. You might wonder, what is Moderna and Pfizer getting paid? So I looked that up. Here's an article that came out 9/20/23, a couple days ago. It's from the American Academy of Family Practice Medicine. New COVID-19 vaccines spur coding overhaul. And at the end of the article, it says this in regards to cost. Payment rates for the new vaccines are not yet available, but Medicare will be required to pay 95% of the average wholesale price, the AWP. And the CDC expects the Pfizer vaccine to cost about $115 a dose and the Moderna vaccine to cost about $128 per dose. Okay, so the Pfizer vaccine is going to cost $115. The Moderna vaccine is going to cost about $128. Let's call it $125. $125 for the vaccine. What do I get paid in my office when I give, say, something comparable? Let's go with an RNA virus, a respiratory illness. Let's go with influenza, something that we've done year in, year out that does actually have a track record that we could lean into a bit. What do I get paid? Well, if you amalgamate the reimbursement rates that I receive through commercial payers and Medicare, we get paid about $25. So that's what patients or insurance companies pay. And I think if we're paying, if someone comes in and is cash paying, I think they pay about $20 or $25 and then maybe $10 to us for administration. You know, the syringe, the needle, the alcohol swab, the Band-Aid, things like that, the nurse's time. So big pharma, I don't know, it doesn't seem right, does it? $25 for the flu vaccines, which actually have a track record, but the COVID vaccines, and we don't know if they're going to stop it, this monovalent vaccine right now, or if there's going to be a couple more this winter. But that's what they're getting paid. Here's what Dr. Marty McCary says about the vaccine. He says, what if I told you 1 in 50 people who took a new medicine would have a adverse event that required medical attendance, and that the manufacturer refused to disclose what the complication was that required medical attendance? Would you take it? And what if the theoretical benefit to taking it only lasted for a 3-month window, 90 days, after which time the benefit was gone? Would you take it? And then they go on to say, this is what we're dealing with the new Moderna COVID vaccine. That's Dr. Marty McCary. Interesting article. Dr. Harvey Reish commented on this one. This was an article in the California prison system. California's really been in the news lately. But this was studying prisoners, and the title of the article was COVID-19 infection rates in vaccinated and unvaccinated inmates, a retrospective cohort study. Authors are Luke Ko, Gary Millett, Lisa Chang, Hugh Yoon, and Robert Mays. And this was in the journal Curious, C-U-R-E-U-S. It says this, results. With the bivalent vaccinated and unvaccinated groups being studied, those 65 and above, the infection rates were 6.45% in the vaccinated group and 4.5% in the unvaccinated group. Dr. Reish redid the numbers and did the calculus over again and said that there had been a small error in it. And he identified that the vaccinated rate was 6.45 and the unvaccinated rate was 4.3. That's an increase in relative risk of getting the disease if you were vaccinated compared to the unvaccinated by 150%. So I'm going to say that again. If you're vaccinated with that bivalent vaccine, you had 150% relative risk, increased risk of getting the disease than if you hadn't been vaccinated. Now, I don't know if there's going to be the study that stands up to the test of time, but the Cleveland Clinic also had done a study indicating that if you were vaccinated, you might well have a greater likelihood of getting the disease. And the California prison system did a study as well. I just reviewed it. And the relative risk for getting the disease was 150% if you got vaccinated. This is an interesting article, Global Epidemiology. It says Volume 5, December 2023. That's interesting because we're only in September 2023, so maybe that's when they're going to print it. The title of the article, Incidence of Guillain-Barre Syndrome in the World Between 1985 and 2020. So between 1985 and 2020, those 35 years. Here's what it says. Conclusions. The highest incident rates for Guillain-Barre were associated with public health events of international concern. Okay. So I'm thinking, for those 35 years, we saw more Guillain-Barre during times of public health events. And I thought, okay, well, what's causing that? What were those public health events of international concern? Well, I remember in 1976 when Jerry Ford got his swine flu vaccine, and they had pictures in the press and all that. And I remember that swine flu vaccine was suspended after a short period of time because there were some 50 deaths reported and several hundred cases of Guillain-Barre. You might be wondering, what is Guillain-Barre? Some people call it French polio, but basically Guillain-Barre is a disease whereby it wipes out nerves, usually starting in the lower portion of the body and then ascending. So we call it ascending paralysis. It's a devastating disease to undergo because you literally lose strength in your lower extremities and then your upper extremities. And if it takes out your diaphragm, you'll die unless you're receiving medical attention. Guillain-Barre is a big deal. It's introduced in this article as an autoimmune disease that affects the peripheral nervous system associated with ascending paralysis. It is the most common cause of acute or subacute weakness in the world after the eradication of polio. And then this article. After having said the highest incidence rates were associated with public health events of international concern, it says this: the non-infectious triggers of Guillain-Barre syndrome include, and it lists 4 things. And the first thing it lists are vaccines, then surgery, then ganglioside administration, and then immunosuppression. Isn't this something that the medical profession and the scientific community should be openly discussing with patients? Shouldn't we be telling you what to look for? I mean, there's lots of things that cause Guillain-Barre that have nothing to do with vaccines. I mean, you've got Campylobacter infections, which is a kind of bacteria. You've got cytomegalovirus. You've got mycoplasma pneumoniae, walking pneumonia kinds of things. Epstein-Barr viruses. But isn't that interesting? And I want to close with this article. Jack Davis, September 2nd, 2023. In Augusta, Maine, Maine General Health has reached out to healthcare workers, many of whom were denied unemployment compensation after they were fired. They were fired because they did not comply with the vaccine mandate that was put in place. So the Maine Wire, M-A-I-N-E, the Wire, W-I-R-E, publishes this article. Former registered nurse Terry Poland shared the message she received from the employer that booted her. Quote, "You were once a proud member of the Maine General team. Would you consider rejoining us? We would be pleased to discuss options with you." End quote. Goes on then to say, as you know, nearly 2 years ago, Maine General had to comply with the state mandate for COVID-19 vaccine. We lost a number of great employees as a result, including you. Terry Poland says, "I was livid. Like, how dare you force me out of a career that I've dedicated my whole life to, take away my livelihood, my ability to earn a good income, and now you think I'm going to come grovel back to you? The result was that she was fired earlier, accused of misconduct, and could not collect unemployment benefits, according to the Maine Wire. Some nurses who were fired later fought back in court and scored victories. State Supreme Court Justice Emilia Kolakova ruled this week that an arbitrator's decision that went against Wendy Cooper were irrational, violative of public policy, and contrary to the interests of justice. Ms. Cooper is an unfortunate victim in the wake of excesses exhibited by governors, administrators, legislators, and yes, even the judiciary. The ruling said, all too frequently did critical thinking and the exercise of personal liberties expire at the altar of false righteousness, fear, and authority. You can't make this stuff up. This is America. This is the country so many of us passionately love and want to be better. This is a legacy that we might like to forget, but we won't. I would suggest that you listen to this video again and pick out the pieces that apply to you or your loved ones. This is astonishing. California gets $93 million. Governor Newsom says he would have done everything differently. The World Health Council says that the regulatory bodies, once public protectors, have been deeply corrupted by vaccine industry. Dr. Paul Offit's not taking his vaccine. The vaccine information statements are not available, but never mind that. Go ahead and give the vaccine, but don't you dare give the vaccine until appropriate informed consent information has been given. Who's getting paid? Well, I get paid $25 for a flu shot, but evidently Pharma and Moderna vaccines are going to cost $125. Relative risk if you get vaccinated for getting COVID compared to not getting vaccinated, relative risk 150% according to a California prison study. GuillainBarre, public health events is when you see a lot of it. Hospitals fired nurses, now they want to rehire them. Have a good weekend.